Hi, my name is Tisha Richardson. I'm in organizational dynamics at the University of Central Oklahoma. Today I'm doing an interview of Adrian Gaither, an RN for Fresenius Healthcare. Okay, Mrs. Gaither, can you please state your name and your title of what you hold at Fresenius Medical Care?
My name is Adrian Gaither, and I am the Peritoneal Dialysis Program Manager for Fresenius Medical Care.
And can you give me your contact number and your email address?
My contact number is 405-945-4347, and my email is adrian.gaither@fmc-na.com.
Okay, so today the questions that I want to get about your organization is, how would you describe the corporate culture of your organization?
We are the number one dialysis company in the country, in the nation. We're international. We were started in Germany. And one of our biggest things is to make sure that our patients are getting the best care while our employees are giving the best care. So that we focus a lot on employee training, making sure that our employees are knowledgeable so we can make sure that we're giving good, excellent, ultra care to our patients.
So can you tell me about a time that your organization went through a major change and how that was handled?
One of the biggest things about dialysis, and that's with any dialysis company, we are managed by our payees, Medicare, insurance, Medicaid, things like that. And we're also governed by the Oklahoma Department of Health and Human Services. So we have to kind of answer to several different organizations. But Medicare changed how they were paying, which when a dialysis patient gets on dialysis, they get on to end-stage renal disease. If they have commercial insurance, so that's like insurance from your job, your commercial insurance will pay for 30 months as primary, and then Medicare will pay as your secondary. After 30 months, it will flip, and Medicare will become your primary, and your commercial insurance become your secondary. So for Medicare to give us optimal payment, we have certain criteria that we have to meet. Our hemoglobins of our dialysis patients have to be over 10, and our albumins have to stay over 3.4. If that doesn't happen, they can basically dock us and decrease how much that we get paid per treatment. So that's not just for one patient, because that one patient is consistently low. This means for the whole clinic. So when these changes started with Medicare, they started a grading system where they can grade all clinics on an A to F system, and it determined how we were paid. It came down to make sure that all of our patients were getting superior care, that all of our employees were properly trained. We had a lot of in-services. We made sure that everybody was trained on what they needed to do, from the president, from the regional director, to the clinical managers, to program directors, to our nurses. So there's a lot of communications from meetings. There was a lot of emails. So just a lot of, we have more direct type of communication once it gets to the actual patient's level, the patient care level. It's more meetings and face-to-face.
Okay. Okay, what was the communication process to the employees as the organization did all that? Did y'all have
once we had our changes and we realized that we made sure first and foremost that the president basically, he let an email to our regional directors to kind of basically pinpoint how Medicare was changing the way that we were getting paid, and making sure that they knew that they had to stress the fact that we needed to make sure that our hemoglobins and our albumin stayed up. Then from our regional directors, it comes down to our clinical managers, and that's the clinical manager over each specific clinic. I am over the peritoneal dialysis, so it kind of splits it. but the clinical manager runs the whole clinic. And then, so we're kind of on the same level, but we're not on the same level. I don't know if that makes sense. So he's not really my boss, but he still kind of runs the clinic. So I have a different manager that I report to, but since we are in the same clinic, I have to answer to him. So what would happen is, so the president to our regional directors, our regional directors to our clinical managers to our actual clinic staff. So it would go from clinic manager, program manager to actual clinic staff.
Okay. And so as these organization dynamic changes was coming through, how do you feel like the employees receive this? Do you think that were y'all okay with the changes? Were y'all not okay with the changes? Was there any conflict in the changes?
A lot of the changes, a lot of the patients, our demographic with our patients are very complicated. A lot of them are not compliant. A lot of patients end up with end-stage renal disease because of hypertension and diabetes. And they're very non-compliant with these two things. So they end up in end-stage renal disease. So we have all of these things playing together. So what happens to the staff is you have a patient and their hemoglobin is low at 2, and we need it to be 3.4 and above. We stress to this patient that you need to eat more protein, eat your protein supplements, do it, we're asking them to do everything that they need to do, but I can't govern them once they get home. So a lot of the staff feel this very unfair because I can't govern what they do at home. A dialysis patient only comes and they're on the machine a lot of times only 4 hours every other day. So what they're doing at home the rest of the time is, it's kind of unfair for Medicare to dock us for something that the patients aren't doing, even though we're stressing that. We have paperwork showing that we have to give education on albumins and phosphorus levels and everything. We have chat days where our dietitians will sit up in the middle of the lobby and talk to them about it, what they're supposed to do, what is good high protein foods to eat. So we try to encourage them as much as possible, but if they choose not to do it, we still get docked on how much Medicare decides to pay us. So a lot of the employees feel it's unfair, but it's really not much we can do about it. So we just have to keep, giving education to our patients and keep encouraging them to try to do what they're supposed to do.
So to me, I feel like Medicare should just probably make the patient sign a statement or affidavit saying that they will follow these guidelines, and if they don't, then Medicare should refuse to pay for them than to dock y'all pay. That is unfair. I agree with what's going on, but I understand under government regulations what they have to have done, and that is something that has to be done. Right. But still, I think that the patient, when it falls back on the patient must take the patient must take some responsibility in their care.
Right.
I mean, this is something that we always talked about at Tinker. Where does the patient take responsibility of their care?
At what point are they supposed to stand up and take responsibility for
some of this stuff falls back on the patient. Right. And if it falls back on the patient, then Medicare and everybody got to start holding the patient responsible also for their care.
Now, it kind of changes a little bit with hemodialysis and peritoneal dialysis. Like when we have issues with hemoglobins, within hemodialysis, a lot of times you have to make sure that your patient doesn't clot on the machine, because then they lose blood. Then they can become anemic. So you want to make sure that they're being heparinized properly. You want to make sure that they are that they're waiting 5 minutes before they put them on the machine to make sure that the heparin gets systemically through the body. You want to make sure that anytime you answer alarms on the machine as soon as they have one. If there's an alarm, you want to address it as soon as it alarms or as fast as you can so the machine is not stopped. Anytime that machine is stopped, there's a chance for clotting. So it makes it a lot easier for a patient to become anemic, because that's a whole system of blood. If it clots, I can't return it to my patient.
Yeah.
So that's a whole system of blood that they've lost.
I mean, it was the same way when I worked at Biomed, so I understand all that part.
So it's very important. But with peritoneal dialysis, it's a little easier to handle their hemoglobin because we use ESAs. erythropoietin stimulating agents. So we use those, and PD doesn't require any blood.
Yeah.
Okay, it's all peritoneal fluid. But we have a lot of issues with albumin because with PD, we pull albumin with every exchange that we do. So our patients basically end up as in a deficit before they even get started. With every exchange, they lose albumin, but if they're not eating enough protein to replace what we're taking, they end up in a deficit, and then it's low, and then we're penalized. So it's kind of like, to me, it equates to like a hamster wheel. We're constantly chasing our tail, trying to make sure that our patients are doing what they're supposed to do. Because as a company, we want to be paid, but we have a lot of people kind of just holding us with our decisions.
So my last question for today is, how does your organization increase team effectiveness?
One thing I can say about Percent is they are very, very effective with taking care of their employees. They have probably every 3 months or so, they offer a survey. So the employees can say if there's something that needs to be changed, are there processes that aren't working, that they may have, processes of things that they may have changed and aren't working. Is it something that we need to change? Are we not giving enough raises? Is there something that we need to do with the team morale that needs to be changed? And they will calculate all of this and then try to make changes across, maybe it's a pattern, between the nurses. They feel that they're not appreciated enough and they don't make enough. So then they'll kind of, look across internationally and may give raises. One thing I can say, it's a very good company. They really do care about their employees a lot. They still offer matching on their 401ks. The benefits are really well. They actually cover domestic partnerships on their insurance. So they try to make sure that they're giving enough benefits to take care of the employees so they can have a higher morale when they come to work and want to take care of the patients. So they're very serious about making sure that their employees are taken care of.
Well, for me, I always believe that morale is very important, especially after being in the military. If you don't have morale, don't nobody want to go to work.
Right.
Regardless if you need to pay your bill.
It can get hard.
It can get hard. And when you already dealing with people with failing health, and then you coming in feeling bad because you ain't getting paid, how are you going to give that patient that optimal care? You're not. You know what I'm saying? How can you put yourself in that compassion mode when I got compassion for myself over here, God, my money ain't right. So I understand. And being a nurse is a very hard job. Anytime you taking care of people and you got to be sympathetic to their needs and make sure that they're okay, and dealing with family members, Lord Jesus, dealing with family members. I understand, because family member come get you, they need some pain medicine and all this, and you be like, I already gave them some, and and they was like, well, they say they still hurting, and they expect for you to jump over the moon to give them family member what they want. But
So
they don't understand rule and
And
regulations.
it's the same thing when you have family members that want to come in when they're on treatment and they can't, because whenever that we're putting on or taking off patients, no family members can be in there visiting their family member, and so they get upset. Well, I'm not over there where they are. Why can't I come in? And it's just the whole regulations. Just if you take care of your patients and you give them good care, a lot of times if they're in a better mood, then
the family member's
in a better mood, and it can kind of guide your day. So one thing I can say about Forcine is they have a lot. They'll order lunch a lot just to kind of this is a reward. Here's something to show you that we appreciate you. They do a lot of little things. Sometimes it's just the little things just to kind of let you know that even though we are a big Fortune 500 company, we still care about our employees.
Okay. So again, if we needed to contact you, can you give me your email address?
It's adrian.gaither@fmc-na.com, and phone number is 405-945-4347.
Well, I'd like to thank you for letting me interview you today. Hope my class enjoyed this video. So thank you very much.
You're so welcome.